Assalamu alaikum, everyone. My name is Mariam Hussain, and I am a speech language pathologist with the Rehabilitation Services Division at Johns Hopkins Aramco Healthcare. In my experience as a speech language pathologist over the years, I've had the honor of working with hundreds of families that had children with autism spectrum disorders. And I'm here now talking to you all because today marks the 14th annual World Autism Awareness Day. That's right, it's April 2nd. It's a very important day for a significant cause. This is a day where people, communities, organizations get together with the aim of raising awareness, creating a more understanding and accepting environment for individuals with autism spectrum disorders. I'd like to take a moment and share with you all some of the reputable events that are happening on World Autism Awareness Day this year. So the United Nations is going to be hosting a virtual event on April 8th, and the topic is very interesting. It is about employment opportunities, an inclusive environment, and challenges post-pandemic for adults with autism. Also, a very resourceful organization by the name of Autism Speaks is hosting a number of webinars throughout the month of April with informative sessions, for example, building social and vocational skills in teens and adults with autism, pediatric occupational therapy, and I know there's a webinar on robotic technology for intervention with autism. So do check out those events. And on a similar note, I would like to start off my presentation today by first of all thanking Johns Hopkins Aramco Healthcare and the public relations team for keeping their commitment to this noble cause by organizing this webinar and allowing us an opportunity to speak to the general public and keeping our share of our commitment to raising awareness about autism. So, as I mentioned, I'm a speech language pathologist by profession. My topic today will be early identification and speech and language services for children with autism spectrum disorders. I will be talking about the role of a speech language pathologist in assessment and treatment. I will be talking about various communication levels for individuals with autism. Also, I'll be talking about various treatment approaches facilitating overall communication skills. So, if you were to visit a speech language pathologist, be prepared that our role in working with individuals with autism addresses not just pronunciation, articulation, and language skills, but most importantly, also social communication skills, learning and cognitive development, and also play development. And as we all know, the core deficits in individuals with autism are around social interaction, verbal and nonverbal communication, and restricted and repetitive interests, behaviors, and routines. In my experience, many parents have often expressed concerns about their children having tantrums and behaviors, and essentially it is a breakdown in their communication skills. Hence, the role of an SLP, a speech language pathologist, is critical in both assessment and intervention. Also note that a speech language pathologist is involved from A to Z, meaning from screening to all the way to discharge. So for example, in Johns Hopkins Aramco Healthcare Speech Language Pathology Clinic, we start off our assessments by conducting a full interview where we look at the history, the medical conditions, the family background. Then we use objective measures, for example, Gilliam Autism Rating Scale or the Childhood Autism Rating Scale, or some excellent screening tools, for example, the modified checklist for autism and toddlers. I'll be talking about that in a little bit of a detail later on. Also in Johns Hopkins, we do have the ability to conduct a full autism diagnostic observer scale assessment, which is the gold standard for assessing autism. Also, a speech language pathologist conducts and formulates referrals to other appropriate services. And most importantly, a specific individualized communication program is developed for each child. Remember, autism is a wide spectrum. There may be children with verbal abilities, or there may be children with nonverbal abilities. So it is most important, as I always mention to my colleagues and the parents, that if it is important to identify where the child's areas of improvement are, it is equally, if not more important, to also identify what the strengths are, what the child can do, because those are the skills that we will use and build on. Okay, and last but not least, transitioning to school with goals and reports. Now, this is a very important factor because in Johns Hopkins Speech Pathology Clinic, for example, we focus on early screening, early diagnosis, the right diagnoses, early intervention. That means starting off the family on the right track. And then, of course, helping the family transition into a school or a center-based environment with all the goals and the reports. The discharge and the transition planning is a very important piece that a speech language pathologist works with the family. So we've talked a lot about early identification and intervention. I just wanted to mention a very nice research-based evidence with the study done by Deborah Fien and her colleagues in 2013. They looked at 34 individuals diagnosed with autism at a much later stage, at age 5. And what they found was that the optimal group, the group that had the most positive results, most positive outcomes, had two things: early intervention and parental involvement. Now, there is nothing that I can stress more than parental involvement and early intervention and early screening. These are three very critical elements that help with enhancing the overall quality of life for young children with autism. So let's take a moment. I know that this is not an interactive session, but I'll try to make it as interactive as possible. Let's identify together. Now, children on the spectrum can have deficits in these three areas, which is communication, social interaction, play, and behavior. So we will look at some of the skills that fall into these three areas. And again, these are the areas that a speech language pathologist can really work with you closely in helping develop and put goals. Now, we will be looking at two things. We'll be looking at what sort of communication skills develop early on, which is from the year 1 to about a year and a half of age. And we will also at the same time look at what are the red flags that we see for children with autism. Here, I want to make a point that, again, raising awareness, doing our share of the support. Not all children that come with a speech delay have autism, and also not all children with autism have speech delays. I've worked with exceptional kids over the years with autism and who had fluent speech and language skills, but they had deficits in their pragmatics and social interaction skills, which is really the use of language. So these children were formulating full sentences, they had full vocabulary, but they had deficits in using this language. They were following very structured approach for their language models. So, you know, it's important to identify that children on the spectrum may not always have a speech and language delay. Okay, again, coming back to our slide early on. So what sort of skills do we see in a normal, typically developing child from the year 1 to about a year and a half, 2 years? Object permanence. Object permanence basically is a foundational developmental psychological skill that develops around 10 months. What is it? It means that any child around 10 to 12 months of age, around 1 year, if we hid an object from the child, for example, if there's a toy in front of the child and we just put a box or a blanket on the toy, the child knows that the object still exists and will try to remove the blanket and look for it. But early on, for children with autism spectrum disorders, they are either challenged by this skill, meaning they find it difficult, or they seem uninterested. So that's a very early marker that our wonderful colleagues in the pediatrics department often check for as well. Number two, children with typically developing skills, they are aware of their surroundings and they're aware of what's happening around them in the room. But children on the spectrum may have limited awareness. So one of the things when children come into my speech language pathology clinic is I often ask a parent to step out of the room after 10 or 15 minutes. Sometimes we notice that the child may not even have noticed that their parent has stepped out of the room. So, this kind of gives us some insight into whether or not the child is aware of their surrounding. Responding to name, we always check for that. So children start responding to their name when called by the age of 1. However, children on the spectrum may have limited ability to do so. And sometimes even at the age of 3, they're unable to respond to their name. And a very important skill called joint attention. What is that? It's a 3-point gaze. So for example, if I showed the child a water bottle, the child would first look at the bottle, then look at me, and then look back at the bottle. Of course, if the child's thirsty and if it's something that the child wants. So this is called joint attention. Again, it develops very early on, but we see significant challenges with joint attention for children on the spectrum. At this point, I'd like to show you a little video that I have on joint attention. It's very interesting. Let me just share my screen here and open up the video. Sorry, just give me a second.
You want to play with? Sigmund measured joint attention in the responses of 3 different groups of children to various stimuli. Normal babies, children with Down syndrome,
Sorry, just
and children with autism.
nice. That the video is working here. I'll play it from the beginning again. Just wanted to make sure.
Sigmund measured joint attention in the responses of 3 different groups of children to various stimuli. Normal babies, children with Down syndrome, and children with autism.
Very nice.
Children with autism don't pay much attention to the attention patterns of other people. They don't really look at where other people are looking. It doesn't seem to occur to them that other people have points of view that can be shared. And so they seem very isolated in that sense.
In a similar experiment, Sigmund studied the reactions of children to someone else's pain. It takes a normal baby only a few seconds to realize that someone is hurt. Children with Down syndrome respond readily to the emotions of others. But someone else's distress doesn't seem to touch a child with autism. It's as though emotions are a foreign language he can't interpret. Reacting to other people's fear is a basic survival instinct.
Okay.
They tell us they have feelings. Their parents tell us that they have feelings. This is another place in which I think our current research shows that the previous understanding of autism was wrong. Their heart rate responses are no different from those of mentally retarded children who are at the same developmental level. So I think that they very much have feelings, but they have a very hard time explaining these feelings to themselves or expressing them in ways that other people can understand.
Okay, just give me a second to come back to my presentation. Okay, so as you all saw the amazing joint attention, how critical that is. And also the video made a very important piece about social and emotional relationship and sharing. So there is a lot of actually recent evidence and research that has looked at the social responses and the emotional responses for children as young as a year old, and found deficits or differences in children that were at risk for autism versus not. So coming back to our slide of early identification versus the red flags in autism. Again, this is another skill that we test for, is whether if a child is playing with a toy, will the child take the toy to their parent and just show it to them, share their enjoyment and excitement with the parent? Because this is something we see as a deficit in many children diagnosed with autism. They would only bring the object to you if they want to request something, meaning they want to open it up or they want something from you. So the showing and shared engagement and enjoyment is a very important skill. Pointing to request. This is again a limited skill that we don't find in children with autism. Again, interest in toys. We find that children on the spectrum have different interests. So, for example, if there's a ring, there's a pole that you want to stack rings on, the child may pick up the rings and either look at it or spin it. So they play with the toys a little bit more differently as compared to typically developing children. Again, ability to shift attention from one thing to another. This goes along with responding to their name, joint attention. Also a limited skill that we find early on when assessing and screening for autism. And a very important one is imitation. I stress on this. This is most often one of my goals that I work with the families and the child, is the child's ability to imitate, whether it's imitating gross motor actions or whether it's imitating verbal models if the child can. Again, imitation skill is also a predictor for long-term prognosis and positive outcomes. So let's talk about communication levels for children with autism. Now, children on the spectrum can be at very different levels. They can be either nonverbal, and in that case, we have to dive into some alternative augmentative ways of communication, which I will be showing you. It could be either high devices, Dynavox, iPads, or just picture boards, pictures to communicate. Or children may be verbal, partially verbal, and that's when also we use other forms of communication, and we also work closely with the behavior therapist to manage communication and language. And also children can be conversational. As I mentioned early on, that some children on the spectrum have well-established language models. It's just that they struggle most in the use of language. And we will be talking a little bit about that too later on. So this is an example of a picture communication board. There's a picture empty here, but essentially it's to give you an idea that when we develop a picture communication board for a nonverbal child with autism or partially verbal, it is individualized. We don't just put together random pictures. We put together pictures that the child and the family is familiar with in their daily routines. For example, a fried egg, maybe their favorite choice, or white pasta, maybe their favorite choice. So we actually work with the family in developing an individualized picture communication board. Here's where I'd like to stop for a second and share another amazing video. Just give me a second, sorry. There you go.
Launch, 2, eat, snack. You want to have a snack? What do you want to have for snack? Tell me what you want to eat. Oh, did it turn off? Let's turn it back on. What do you want to eat? Eat, snack. What do you want? Do you want cheese? Yeah, you show me cheese. Cheese. Cheese and crackers. You want cheese and crackers? Do you want anything to drink? What do you want to drink? Milk. Milk. Can you say please? Please. Very good. Okay.
Okay, let's come back to the presentation. Just give me a second. So as you can see in that video, the child, actually the child had something called childhood apraxia of speech, which is a motor speech disorder. The child didn't necessarily have autism, but it was a very good example of how someone can use a very high functioning device and actually be able to communicate their basic needs. I'm going to talk about some quick screening tools. The modified checklist for autism in toddlers is an excellent screening tool that we also are currently using in Johns Hopkins. Our wonderful colleagues in the pediatrician department actually screen the cases there and refer any child who scores at high risk to the speech language pathology service. So this is our efforts that we actually started a few years ago in early identification and early screening. This tool is very easily accessible on the website and also readily available in many languages, even Arabic. Another way that we speech language pathologists may screen children is using some age-appropriate toys. For example, rings, telephone, bubbles, cars, and just watching and observing how the child responds, how the child interacts, how the child uses the toys. Some of those skills that I just mentioned a few slides ago. Is the child pointing? Is the child responding to name? Is he or she aware of his surroundings? So just using a bunch of toys can help us really identify kids very early on and then make the referrals appropriately. It's also very important to check for interest in repetitive behaviors. For example, if the child's spinning the rings or if the child has any repetitive hand movements, etc. So as I mentioned, the modified checklist for autism in toddlers revised is easily accessible online, and anyone can actually fill out the screener, and if they are concerned, and then of course seek an appointment with their pediatrician or speech language pathologist. So if a family observed any red flags early on, what are some of the things we are supposed to do? As I mentioned, fill out the screener, which is readily available with the pediatrics department in Johns Hopkins. And then either you will be directed to a child psychiatrist or a child psychologist or the developmental pediatrician here. Sometimes a neurologist is involved as well, a speech language pathologist, occupational therapist. So those are the different services that one could expect to see early on in the assessment phase. And now I'd like to talk a little bit briefly about some unique treatment options that are available out there. So we are all familiar with this traditional structured speech therapy program and occupational therapy and physical therapy. Those are the rehab services. But some interventions that are unique, one of them is called video modeling. And then another one is social stories and social circles of trust. And of course, I will talk about some iPad apps. So let's look at video modeling. Video modeling basically is a technique where the child watches something, observes the screen, learns, and then tries to imitate that behavior. So let me show you that in a visual form. So for example, this child is looking at the screen where he is watching an adult hold a book. So this is a pre-literacy skill, print concept, hold the book, how to hold the book, how to look at pictures, and then pointing to pictures, turning the pages. So essentially, after the child has watched this video over and over again, the child attempts to imitate the same behavior. Of course, it goes without saying that the child should have joint attention, should be able to shift his attention between the screen and the object, and should have some ability to focus and attend and imitate as well. So video modeling, I'd like to say, while it may seem like a very simple concept, but it is a word of caution that should be implemented under the guidance of a competent and skilled professional, because there are very different types of video modeling programs out there. There's self-modeling, video modeling, point of view video modeling, and video prompting. I won't be going into details for that, but this is, I wanted to share this as one of the unique treatment opportunities out there. Another one is social stories. It's very, very popular with children on the spectrum. Again, a social story is essentially developed for a child, it's individualized, and it's developed to address a certain behavior and assist the child in responding appropriately or effectively. I just gave an example here of a sequenced story. So let's say a child was having difficulties with brushing their teeth. One could easily develop a social story for that child around brushing teeth, and that could help the child not only sequence the events, but also know what's coming up, so predictability, and also know what sort of language to use in each one of those steps. Another really interesting topic that has gained a lot of research lately is the social circle of trust. Now, most of the families with older children, so 5 and above, have often come up to me and asked me about their children not being able to understand personal boundaries or stranger safety or personal space. So the Circles Social Skills Utility App program, again, I'll say the Circles Social Skills Utility App is a specific program that actually addresses some of these areas of concern. As I mentioned, stranger safety or personal boundaries. I've had a lot of parents give me examples such as, my child, while waiting in the waiting room, just went up to a stranger and gave them a big hug. Some of these children don't really understand how to behave with strangers versus friends versus family members. So there is a specific program addressing this as well. As I mentioned to you, this organization, autismspeaks.org, actually has a web page where you can go in and choose the area that you would like to work on. For example, functional skills or language or math. And accordingly, they will recommend some apps, some applications, some apps that you could download and use with your child. This is a very common question I get from a lot of parents. What kind of apps would you recommend? This is one of the apps that I personally have used for my patients. It's called Jab Talk. It's available on Android, and it allows us to take photos of objects that are very common in the child's environment and actually record your own voice as well. So the child can actually use pictures to communicate his basic needs, as we saw a while ago in the video. Some other resources, Autism Arabia, Gulf Kids, Autism Speaks is a big one. Some apps that are very useful, Baby Bus, Story Free, Awal Kalimati, Haywanat al-Mazra'a. Just some good, useful apps that I've found that have helped children gotten their interest and learn from it as well. So, the takeaways from my presentation and talk today is that early identification and intervention is key. So remember, it's not just early identification. Let me go through the steps again. Early screening, early diagnoses, and the right diagnoses, and for which you have to seek out a psychologist or a developmental pediatrician or a child psychiatrist. And then early intervention. Okay, the right program addressing both strengths and areas of improvement. And finally, knowing what the long-term plan is. So hospital settings not necessarily provide long-term options. So it's more important to know what sort of early intervention setting and school structured environment will my child have. Modified checklist for autism in toddlers is an amazing screening tool, readily available. And of course, creative intervention. Don't just follow through with a cookie cutter approach. So something that may fit one child on the spectrum won't necessarily fit another child because the spectrum is so broad. And raising awareness. So while my presentation today focused on speech and language skills for children with autism, but the most important takeaway message I'd like to focus on today is how each one of us can make a difference and show support. So I'd like to share some examples, 3 examples, how you guys can make a difference today. Number 1, raising awareness. And that means talk to your friend, your colleague, your neighbor, even if they are someone who don't know about autism. Talk to them about autism. Maybe share something you learned from the webinar today. Essentially, our goal and vision is to break through the stigma and the myth that children with autism cannot make friends or children with autism cannot communicate. Remember, autism should not be really viewed as a disability. It's more a different ability. They just have different, children on the spectrum just have different abilities to cope and learn and communicate. So our goal, as I said, is to create a more inclusive and accepting environment for individuals with autism. So raise awareness. Number 2, volunteer your time. I know many hospitals, organizations, and centers are always on the lookout for competent and compassionate people to work and enhance their programs. So if you are able to volunteer, and that could be your contribution. And another really creative one, which is something I have learned from the parents and families that I worked with. Many families have expressed their concerns that children on the spectrum don't often have peer interactions or play dates. So if you know a family with a child with autism, and if you are able to, organize and host a play date. The play date could be around a trampoline, could be in the park on the swing. Now remember, most children with autism spectrum disorders do very well with one-on-one facilitated play dates, and especially if the play date has sensory-based activities. So this is one unique way you could show support to both the child and the family. Last but not the least, again, I'd like to thank JAHA, Johns Hopkins Aramco Healthcare, one more time for giving me this opportunity to reach out to the general public. And essentially this year, World Autism Awareness Day, the focus should really be on creating a more kinder and more inclusive environment for not just individuals with autism, but also for anyone who loves and cares and support for someone with autism. That may include a family member, a parent, a caregiver, a sibling, or even a teacher. So I'm showing my support, and I hope you will do too. And thank you very much for your time today. Thank you for listening in, and ma'asalama.